Hello, this is Simone Fritschi. I'm one of the doctors at Swiss Mountain Clinic, which is a holistic clinic in the Italian part of Switzerland. And I'm working here since 1.5 years. I came from Berlin, working there as a cardiologist and a specialist for internal medicine. And now I opened up to the field of holistic medicine, and I am here now, and I am very happy to present our guest, Alberto, who came to visit us in this clinic again for inosphoresis, which is the cleansing of blood from toxins. And he is a well-known researcher in anthropology, and he brought us his new book, and I'm very excited to talk to him now.
Thank you, Simone. This is my new book, Grow New Brain, how you can grow a new brain, but you can also grow a new heart. But did you know that we grow a new brain every 22 days? It's a process called protein synthesis, because brain cells don't divide, right, but they change all of their components. Mm-hmm. And in 22 days, all of the components are changed. So it's so important to protect the brain. And remember, the brain is a hormone organ that's very affected by microplastics. And that's one of the things we came to do here, because you offer a therapy that we don't have in America, which is the inosphoresis, where you filter the blood of heavy metals and toxins and solvents and pesticides and microplastics that are hormone disruptors and right, brain disruptors. Right. And there's so much anxiety and mood disorders now. Mm-hmm. But I know your specialty is the heart, and I wanted to ask you, how long does it take to grow a new heart?
Well, maybe I would have to ask you, because I have to confess that these things, what you just told me also about the brain, that, the components of a cell, that they are like exchanged in 22 days, it's totally new for me. Similar things are maybe a little bit better known regarding the liver. So we know that the liver can regrow again. With the heart, I don't have a clue. Do you know?
Yeah, a little bit, but with the skin, for example, you get new skin cells every 6-7 days. Mm-hmm. New skin, and your GI tract and all of your mucosa every 3 days. Mm-hmm, mm-hmm. You get new mucosa, and it's the same everywhere in the body, because in every 7 years, every molecule in your body is exchanged. Mm. So there's nobody in the planet that's older than 7 years old. Yeah. Really. And the heart also is so active, that it changes the component parts, but the cells also divide. But especially because the heart has so much work to do, the mitochondria are very important, the energy factories. Mm. And so on the average, I think the heart, every 30 to 45 days, the heart cells divide and are replaced. Mm. But the internal components are replaced more frequently.
Sure. Yeah. So I know that you are working with the methods you bring into this world also to heal hearts. Could you tell me a little bit of your work? How would your approach be if someone has had an emotional trauma causing severe heart issues?
Well, ideally, you want to prevent heart trauma, because you want to prevent disease in general. Instead of having to treat disease, we want to treat health, so we don't have to treat disease. And the heart, it turns out, is not an isolated organ. When we went to the university, we learned that we were composed of all of these organs. But you don't look at an eagle. An eagle is not a group of organs. It's an eagle. It's a system, and these organs work in a systemic way. Mm-hmm. So the heart is connected to the gut, and it's connected to the brain. It has 100 million neurons in the heart. So we have a heart brain, and then we have a gut brain, and then we have, of course, the brain inside our head, which is the one we use the least. Most of the work is in, the heart is the great drummer, the rhythm keeper of the body.
Which is maybe also the reason why we can work with sounds to calm the body, to calm the heart, and to positively affect these heart-brain axis and heart-gut axis.
They're connected with the vagus nerve. It's a very ancient nerve that goes from the brain stem, the bottom of the brain, a very ancient brain called the reptilian brain that we share with all the reptiles. And it connects to every organ in the body. And this is the nerve where we store trauma. So the vagus nerve is just all traumatic memories are stored there, and it's very difficult to reset. Breathing practice, meditation, heart rate variability. I wanted to ask you about HRV, heart rate variability, and how that's a marker for...
there's great scientific data regarding heart rate variability, which is very interesting, I think, because in my practice before, it didn't play a big role. So we would not measure that on a regular basis, and we would not focus on the heart rate variability in cardiology practice. But since I'm working here, we do that on a regular basis. So we measure it, and we do see many differences, of course, in people coming here. But we also do see that patients who come to this place who are not feeling well, that they are in a sympathetic state, where the sympathetic autonomous nervous system is very dominant. But we can also see very nicely that under guided breathing, that this sympathetic nerve is getting less pronounced and is getting less dominant, and the vagal nerve is coming up. So, and that is really nice to show that to people, that they themselves can influence the autonomous nervous system so easily.
So why do you want to have variability in your heart rate? It doesn't make sense in a way. You want a steady rhythm, heart rate that doesn't have a lot of it. Why would you want to have a lot of variability in your heart rate?
So it is, you don't want to have chaos on the one hand, but you don't want to be stiff on the other hand. So heart rate variability means for me to remain smooth.
In the flow, in a way.
In the flow. And also, I think in ancient cultures, you know better, I guess, but the measure of the pulse and to feel that heart rate variability was used as a mean already in medicine. And if it was very stiff, people would know that death is close.
Schauen Sie QS24 ohne Werbeunterbrüche auf Wikisana und nutzen Sie dabei die weltweit einzigartige KI-Suchanfrage. Stellen Sie Ihre individuellen Gesundheitsfragen und profitieren Sie von exklusiven Sendungen.
The death is close. That's not a good idea. No, the more variable, the more fluid, more adaptive, resilient you are. Whereas if it's very stiff, you're ready to die. You don't want to do that. And that's what happens when you're not able to go into parasympathetic nervous system, no? Could you tell us a little more about that?
So the parasympathetic nervous system is very important if it comes to healing, because we can heal and we can regenerate if we are in the parasympathetic state. When we are not stiff, then it comes to, we start to digest more easily, we start to breathe slowly, we start to relax, and in different organs, different regeneration scenarios can start. like the healing of or the build-up of new tissue in the heart after a heart attack, or, for example.
It's the rest and digest versus fight or flight.
That's it,
Yeah, so important, because the fight or flight that we're living in creates these horrible stress hormones in the brain. I mean, they're survival hormones, adrenaline, cortisol, if you have to fight a tiger. But when you're stuck in traffic, you don't want to have a lot of adrenaline because you cannot fight and you cannot run.
Right.
Then you get stuck basically in sympathetic.
Now, before you just said, so ideally, you would like to prevent disease, you would like to prevent trauma. But isn't it so that we all come to this world, not all, but most of us come and do suffer from trauma at a certain point of time? And secondly, isn't it so that that stress is getting more these days, and so that we have to focus on these topics, sure, to prevent disease, but many people, so autoimmune disease, but also depression and anxiety, but also cancer and cardiovascular disease, they are still on the rise. And so we are already a little bit late if it comes to prevention. What are your thoughts about on that?
Well, it's never too late to practice prevention, no matter what disease you have.
Yeah.
But the important thing is to remember you're not a disease, you're not a diagnosis. So you can have a disease, but it's not who you are. And you want to find out why you have it, not what you have. Like in America, you want to know, what do I have? And it's really why, the medicine of why is more important than the medicine of what. And in terms of trauma, the one thing that we're learning from the brain and from neurology is that there are no traumatic events. There are no traumatic events. There are only traumatic experiences. So you and I can have the same experience, and for me it can be very traumatic, but for you it can go, wow, what a life lesson. I'll never do that again. So this is what differentiates. When you're in trauma, you're stuck in time. You keep reliving and repeating that experience. In India, they call it karma. Or I have a friend of mine who invited me to his wedding, and it was his 4th wedding. And he said to me, but it's different, Alberto. I said, right. I said, you have to stop looking for the right person and work on becoming the right partner. So you change yourself instead of trying to find the right. So this is how we can turn trauma into lessons, so we don't have to keep repeating the grade.
So, and maybe you have an advice for me as a former only school medical doctor, now opening up to holistic medicine. Where do you think, or how do you think should conventional medicine and holistic medicine develop? How can they come together? What can we learn from each other? And what is maybe good to still have in your hands and to keep? And what are new ways we want to maybe go for?
That's a very big question. But, at the beginning, remember, Western medicine is the best medicine we have. If you have an accident, if you have an automobile accident, you want to go to the emergency room. But in terms of chronic conditions, it's very bad. It's not very good with chronic. And that's more lifestyle related. So it's what you eat, how you think, how you laugh, how you love, how you forgive. And those is the emotional component, or the somatic, the psychosomatic. And we know we can create psychosomatic disease, but we also can create psychosomatic health.
Sure.
And then you have the level above that is the kind of the spiritual. The spiritual means not what God you pray to. That's religion. Okay, spirituality is about exploration. It's about what's your life purpose. You have to answer 3 questions in spirituality. Who am I? Where do I come from? And where am I going? And if you can hold, you don't need to come up with an answer, but if you can hold the questions, then healing happens at the physical, happens at the emotional. Who am I? Am I the product of a terrible family? We all are, you know. I am convinced that the stork dropped me off at the wrong house. Should have dropped me off at my best friend's house. I had the really good parents, you know. So we find a meaning, purpose, direction at the spiritual realm, and then we return to nature. We become natural beings again. So at all of these levels, we have to be able to work. And then we understand that we're energy beings. We're energy beings. That from the biological, at the level of mitochondria, to the energy fields that surround the physical body, to the energy field in your home from 5G telephones or from internet or from electromagnetic fields, to your subtle fields that organize the physical body, that contain information, not just your DNA, but your energy field. So the holistic medicine really includes all of these dimensions, the emotional, the life purpose and meaning, not what God you worship, that's religion. This is spirituality, is an exploration. And then, of course, the energetic. How do you relate to the visible and invisible worlds?
So as you mentioned, you have your own sort of clinic in Chile. Is that right?
Yes, we have a clinic in Chile, but we also have one in the US. And in Chile, we do many of the things you do here. We don't have an excellent cardiologist like you, so if you ever leave Switzerland. But in Chile, we work strictly on the energetic. Primarily, we work with mitochondrial medicine. We have to renew mitochondria, supported, because they don't even belong to us. You know, they're bacteria that became incorporated into our cells, and mitochondria are everywhere. Trees have mitochondria, and grasshoppers and whales, and they're the only life form in the planet, really.
So I find that interesting. So in the US, you work to support mitochondria on a more physical level, and in Chile on an energetic level, is that right?
We do both. In Chile, we'll do the hypoxia, hyperoxia, which takes you from the beach to the top of Mount Everest every 4 minutes to kill off the weak mitochondria, regenerate the good mitochondria. We work with supplements like ubiquinol, CoQ10. We work with the nutritional side, and then we work with the energy field.
Which means?
Which means that the body is surrounded by an energy field that's created actually by electrical activity in your long nerves, in the way that a wire has a magnetic field around it. We have a electromagnetic field that is not energy, is not heat, it's not fuel, it's information. It contains information that's continually encoding the body. And if you can upgrade the quality of the information in the system, you can upgrade the system.
And how do you do that?
We need another 15 minutes from you. This is in my earlier books, and you can take a look through my earlier books. We also have online courses and trainings. And we have, in our attempts to become scientific in psychology and in medicine, we have neglected the energy world. And the only people who really understand it are the quantum physics. So the quantum physicists say, yes, everything that's interesting that's happening is happening in the field, in the quantum field. And that is true. And our science is moving a little bit more towards the biofield, the biological energy that it creates and informs life, and how we can upgrade that, or we can downgrade it, and when we do, we get sick. And there are people that you walk into a room and you feel in their presence and you feel so good. There are other people you come and you sit near them in an airplane, you go, oh, this is terrible energy, and this brings down the quality of your field, because we vibrate with each other. Yeah.
Right. Yeah. Thank you so much, Alberto.
The pleasure. Thank you for inviting me to be in your clinic, and it's always a pleasure.
Thank you. Thanks for being here and bringing all of this knowledge to us.
Ja.
Vielen Dank, dass Sie mit Ihrer Aufmerksamkeit QS24, Ihr Schweizer Gesundheitsfernsehen, bereichern. Entdecken Sie Wikisana und finden Sie Ihren sicheren Ort für ganzheitsmedizinische Inhalte. Und wenn Sie unseren YouTube-Kanal abonnieren, verpassen Sie ganz bestimmt keine neue Sendung. Unsere Reise endet nun, aber Ihre kann weitergehen. Hier eine Liste an weiteren Sendungen für Sie zusammengestellt. Ich wünsche Ihnen alles Gute und allerbeste Gesundheit.